Hi everyone, welcome back to the RSNA Radiographics podcast. I'm Cherie Wang. Today I'll be talking about the article titled New Follow-up and Management Recommendations for Polypoid Lesions of the Gallbladder from Dr. Konstantinov et al., which is part of the Radiographics Update series. I want to quickly introduce this series to our listeners and readers. Radiographics update articles supplement or update information found in full-length articles previously published in Radiographics. These updates, written by at least one author of the previous article, provide a brief synopsis that emphasizes important new information, such as technological advances, revised imaging protocols, new clinical guidelines involving imaging, or updated classification schemes. I really enjoyed this article because how many times do we see gallbladder polyps and wonder, what should we be doing with this? What is the follow-up and management we should be recommending? These are often incidental findings in our patients, and like everything in medicine and radiology, it is important for us to always keep up to date. Dr. Melnick, who is the senior author on this paper, first described the disease spectrum of polypoid lesions of the gallbladder with pathologic correlation back in 2015. This new article provides an update on this topic since that time and includes a summary of the recently updated Society of Radiologists in Ultrasound follow-up and management recommendations for gallbladder polyps. For me, I find that I can sometimes be in a bind with these lesions because gallbladder polyps are really common. They're usually incidental and they have a broad differential diagnosis, which can be benign or malignant. The overlap of imaging findings in benign and malignant gallbladder polyps makes this even more difficult. It is important to identify high-risk lesions before they become invasive or metastatic. This is where we, as radiologists, can play a role, as gallbladder cancer is often asymptomatic, thus difficult to detect clinically, resulting in late-stage diagnosis and poor prognosis. So why these new updates and revisions? Well, since the original publication in 2015, there has been growing data to show that most gallbladder polyps are benign, particularly small polyps. Additionally, multiple studies have suggested that prior size and growth thresholds were too conservative and that only a small portion of gallbladder cancers may actually arise from polypoid precursor lesions. Aggressive management of likely benign gallbladder polyps with surgical resection and prolonged imaging follow-up is not without potential harm, including surgical risks associated with cholecystectomy, patient anxiety, unnecessary cost, and inconvenience. So now we're going to talk about the different criteria. The first one is gallbladder polyp size. Previous guidelines recommended follow-up of polyps 6 to 10 millimeters in size, and cholecystectomy of polyps larger than 10 millimeters. We know that neoplastic polyps tend to be larger than non-neoplastic polyps, and evidence has continued to support this. One study in 2020 showed that with gallbladder polyps larger than 10 millimeters, the incidence of gallbladder cancer was only 0.4%. Another study in 2021 found that size greater than 15 millimeters was an independent risk factor for identifying neoplastic polyps. In 2022, members of the SIU were surveyed in an estimated combined total number of gallbladder imaging examinations exceeding 3 million, and no respondents had ever seen a pedunculated polyp smaller than 10 millimeter that was proven to be malignant. Updated follow-up and management recommendations have increased the size threshold for cholecystectomy in low-risk morphology polyps to 15 millimeters. Next, we have changes in gallbladder polyp size. Previous guidelines recommended that threshold growth of 2 millimeters per year warranted surgical referral. Multiple studies have investigated the significance of polyp growth and suggest the nature history of gallbladder polyps commonly includes slight growth, so between 2 to 3 millimeters per year, as well as fluctuation in size. Additionally, polyp growth in these studies was not found to be associated with malignant potential. As a result, updated guidelines have increased the rate of threshold growth, interval growth, to 4 millimeters per year. So, why the fluctuations in polyp size? Well, it depends on the cause of the polyp. For example, with cholesterol polyps, the cholesterol may dissolve and precipitate out of the bile solution. It may be phagocytosed by macrophages, or the polyp itself may just slough off. In the case of pedunculated polyps, the base of the stalk remaining may subsequently act as a nidus for regrowth. Technical factors and fluctuations in gallbladder distension may also result in variability in polyp visualization and appearance. Next is gallbladder polyp morphology. A study in 2020 showed that neoplastic polyps and gallbladder cancers were more likely to have the appearance of focal wall thickening. Previous histopathological analysis showed that cholesterol polyps had very thin stalks, correlating with the extremely low risk pedunculated bore on the wall morphology and pedunculated with thin stalk morphology described in the updated SRU guidelines. Next, we have duration of follow-up. In a previous longitudinal study, it was found that over 50% of gallbladder cancers were diagnosed within 6 months after initial polyp detection, and that the rate of gallbladder cancer detection dropped to nearly 0% by the 4th year, suggesting that long-term follow-up beyond this time is low yield. Hence, the updated SRU guidelines recommend a maximum of 3 years of follow-up. For all of us who are very visually oriented, which is every radiologist I know, I would urge you to download and look at the algorithm flowchart in this article. You'll want to bookmark this. In the SRU algorithm, the size and morphology of the polyp must be first described. Subsequent risk stratification is based on the morphology of the polyp. Pedunculated bore on the wall morphology and pedunculated with thin stalk morphology are considered extremely low risk. Pedunculated polyps with a thick or wide stalk and sessile polyps are considered low risk. Focal wall thickening adjacent to a polyp is considered intermediate risk. Polyp size within each criteria then determines management recommendations. So in summary, compared with previously established practice guidelines, the main updates in this new algorithm include risk stratification based on morphology, maximum of 3 years of follow-up. Previously, this was 5 years. There has been an increased threshold growth of 4 millimeter per year. Previously, this was 2 millimeters per year. An increased size cutoff for surgical resection of 15 millimeters. Previously, this was 10 millimeters, except for the indeterminate risk group, where the surgical cutoff was lowered to 7 millimeters. For polyps 10 to 14 millimeters, surgical consultation could be considered depending on patient risk factors or threshold growth at follow-up studies. The European guidelines have also recently been updated. While some specifics differ with the SRU updates, both consensus groups have made changes towards more nuanced risk stratification for gallbladder polyps, overall recommending long-term follow-up and less cholecystectomy for patients. Imaging evaluation of gallbladder polypoid lesions remains a common and at times challenging clinical scenario, as there can be significant imaging overlap between neoplastic and non-neoplastic lesions. Since 2015, evidence has grown for a benign course for the majority of gallbladder polyps. Updated follow-up and management recommendations from the SRU have recently been published reflecting these trends. Key highlights from this include new risk stratification of polyps based on morphology, with follow-up and management recommendations based on size within each risk stratified category, as well as shortened duration of longitudinal follow-up with a maximum of 3 years. I hope you enjoyed this RSNA Radiographics podcast episode. Please do take a look at this article online, especially the very useful algorithm flowchart. Remember, you will want to bookmark this. Thank you for joining us today and see you next time.